Good day everyone, my name is Chris Dinyalan Sumawang from BSN 1B, and for today I will be conducting an assessment on the mouth and the oropharynx. So for our preparation, we need to assemble our equipment. We do need to have a clean gloves, a tongue depressor, a 2x2 gauze pad, and also we do need to have a pen light. Now let us proceed to our procedure. First thing that we need to do is we need to introduce ourselves to the patient and assess whether the patient has the ability to assist with our procedure. So hi ma'am, my name is Chris, and for today I will be your nurse. Is that, may I know your name?
Francine po.
Okay. So Miss Francine, today I will be assessing your mouth and your oropharynx. Is that okay with you?
Yes.
Okay, thank you po. So for our next step is we need to perform hand hygiene and observe other infection control procedures. Okay, so for our fourth step, we need to provide some privacy for the patient by closing the curtains around bed and closing the doors to the room if possible. So for our fifth step, we need to inquire the patient if he has a past history of the following. So ma'am, nagkaroon na po ba kayo ng routine pattern sa dental care po?
Hindi po.
Okay, so kailan po yung last visit niyo po sa dentist niyo po?
Hindi pa po ako nagpa-dentist.
Okay po. So, nagkaroon na po ba kayo ng, nakaranas na po ba kayo ng ulcer or other lesions po?
Hindi po.
Okay po. So, do you have any dental discomforts po?
Wala naman po.
Okay po. So, for our last question po, meron po ba kayong mga medications na tinitake ngayon?
Wala po.
Okay po. So, that would be all po sa ating inquiry. So, we will now proceed to the assessment of the patient's lips and the buccal mucosa. So for our first step, we need to inspect the outer lips of the patient for symmetry of contour, color, and texture. Diba? Tingin lang po dito. Okay, thank you po. And for our next step, we need to inspect and palpate the inner lips of the patient as well as the buccal mucosa. And for the color, moisture, and texture of the inner lips and the buccal mucosa. And to do that, we will need a tongue depressor and a pen light to inspect the buccal mucosa as well as the parotid ducts. Tingin lang po dito. Nama po tayo. Okay, thank you po. Now we will proceed to the assessment of the teeth and the gums of the patient. So for our first step, we need to inspect the teeth and the gums of the patient while examining the inner lips and the buccal mucosa of the patient. So we need to inspect whether the gums inspect the gums for color, bleeding, edema, and retraction and lesions. Nama po tayo. Okay. Thank you po. And for our next step, we need to inspect the dentures. So we will ask the patient to remove completely or partially the dentures, and we will inspect their conditions, noting the particular broken or worn areas. So our patient has a complete set of teeth, 32 of them. So she is not wearing any dentures. Okay, we will now proceed to the assessment of the patient's tongue as well as the floor of the mouth. So first thing that we need to do is we need to inspect the surface of the patient's tongue for position, color, as well as the texture. So to do that, we will need to ask the patient to stick her tongue out and move it from side to side, as well as by doing that, we will examine the patient's tongue for color, texture, position, and the tongue's mobility. So ma'am, tingin niyo pa po tayo dito. Can you stick out your tongue po? Move it from side to side po. Okay, thank you po. So now we will proceed to the inspection of the tongue's movement. So to do that, we will be asking the patient to roll her tongue upward and move it from side to side again. Okay, ma'am, tingin po dito. Can you please move your tongue upward po and move it from side to side po. Okay, thank you. Next is we will be inspecting the floor of the mouth, the base of the mouth, as well as the frenulum. To do that, we will be asking the patient again to place the tip of her tongue to the roof of the mouth. Okay? Ma'am, pwede po bang pakilagay po ang tipin ng inyong tongue po sa roof po ng inyong mouth? Okay, thank you po. Okay, thank you po. So for our last step in the assessment of the tongue, as well as the floor of the mouth, we will palpate the tongue and the floor of the mouth to assess whether there are nodules, lumps, or if there are excoriated areas. So we will be using a piece of a gauze and grasp the patient's tongue, and using our index finger on the from the other arm, we will be palpating the base of the tongue, the back of the tongue, as well as the borders of the tongue. Ma'am, tingin lang po dito. Can you stick out your tongue po? Labas po natin. Okay. Labas po natin. Taas po natin. Okay. Okay, thank you po. Okay, now we will be proceeding to the assessment of the patient's palate as well as the patient's uvula. So the first thing that we need to do is we need to inspect the hard and the soft palate for the color, the texture, the shape, as well as the presence of the bony prominences. To do that, we will need to ask the patient to open her mouth wide and to tilt her head backward. And we will be using a tongue depressor to depress the tongue, and we will be using a pen light for appropriate visualization. Okay, ma'am, tingin lang po dito. Ma'am, open your mouth po. Okay, thank you po. And for our next step, we will be assessing the patient's uvula for its position and mobility. So to assess or to inspect the uvula, we will need to ask the patient to say "ah" so that the soft palate rises. Okay, ma'am? Can you please say "ah" po? Okay, thank you po. So now we will proceed to the assessment of the patient's oropharynx as well as the tonsils. So for our first step, we will be inspecting the oropharynx for its texture as well as its color. And to do that, we will be assessing one at a time, one side at a time, to avoid eliciting the gag reflex. And to expose the one side of the oropharynx, we will need a tongue depressor, and we will depress it against the tongue on the same side. For about halfway, while the client or the patient is tilt head back, as well as the client open her or his or her mouth wide. Also, we will be needing to use a pen light for the, if appropriate, and for better visualization. Okay, ma'am. Open your mouth po. Okay, thank you po, ma'am. And for our next step, we will be assessing the patient's tonsils for its color, discharge, and size. And for our next step, we will be eliciting the gag reflex. We will be pressing the posterior tongue of the patient by using a tongue depressor. Mga po tayo ng malaki po. Ibaba po ay i-stick po natin ang ating tongue ng konti. Okay, thank you po. And for our documentation, we will need to record our findings to the client's record. For our evaluation, the patient's mouth and oropharynx was assessed accurately without any injuries, and the patient only experiences minimal discomfort. And for our documentation, we will need to record our findings to a piece of paper, a flow sheet, or a computerized record. As well, we will need to report abnormal findings to the appropriate person, and also we will need to identify the site of assessment. And that would be all for the assessment of the oropharynx as well as the mouth. Thank you very much.